Hello, dear colleagues. My name is Professor Dr. Aysun Yilmazlar. I am anesthesiologist and intensive care, and also I am coordinator of lean and quality in my hospital. I want to show a lean healthcare practice example. A lean approach in healthcare is based on the provision of healthcare services without deficiencies or errors in the optimum time. Many lean tools are used to achieve this, one of which is the visual tool known as a shadow board. The shadow board is an assistive template comprising shadow pictures of all the drugs and instruments required for a procedure. Now I like to show you spinal anesthesia preparation for spinal anesthesia. In this study, we evaluated a total of 40 cases of cesarean section operation applied with spinal anesthesia. In 20 cases, the shadow board was used as a visual template including pictures of gloves, spinal and skin local anesthetics, sterile square gas pads, 2 and 5 ml shrinks, and antiseptic solutions. The same anesthetic technique prepared using the traditional method was applied to the other 20 cesarean section cases. As you see here are spinal anesthesia preparation for with shadow board, and the other picture shows traditional method for the preparation in spinal anesthesia. In traditional method, usually we always forget one equipment for spinal anesthesia preparation. If we use traditional method like this, the necessary equipment we prepare by our mind. I would like to show you shadow board for spinal anesthesia preparation. As you see here, you can see all my drugs and equipments picture on this template. So, if I decide to prepare spinal anesthesia, this is for my guide for the procedure. Now, the first of all, I need sterile dressing package. And the first of equipment is my gloves. And the second is my square gas and antiseptic solution for skin sterilization, and the shrink for skin local anesthetic, and local anesthetic for skin, and the other shrink for spinal local anesthetic. And this is my spinal local anesthetic, and this is my spinal needle, and the band, and the last medication, ephedrine for the hypertension medication. So I'm ready for spinal anesthesia. We recorded the duration of anesthesia preparation and application. The application time was calculated as the time from the needle entry to the skin for local anesthesia to the time of removal of the spinal needle from the skin. Spinal anesthesia performed by the same anesthesiologist, and data were analyzed with the person chi-square test. In this table, there are no differences between the two groups. We can see here the duration of spinal anesthesia is more short than the traditional method. And also the duration of anesthesia procedure is short in the shadow board spinal anesthesia preparation. The mean preparation time of the spinal anesthesia was 18.30 seconds with the shadow board method and 44.50 seconds with the traditional method, and the difference was determined to be statistically significant. On the other hand, the mean duration of application of the spinal anesthesia was 51.85 seconds with the shadow board method, and 54.05 seconds with the traditional method, and with no statistically significant difference determined between the groups. In the traditional method of preparation group, there were unnecessary movements in 3 cases: forgotten to prepare the 5 ml shrink in 1 case, and the sterile square gas pads in 1 case, and the ephedrine in 1 case. These types of problems were not encountered in any case where the shadow board was used. As a conclusion, this study was planned with the thought that the use of shadow board in the process spinal anesthesia preparation could contribute to the intervention, and as a result of the study, it was determined that the shadow board made a considerable contribution to the speed and correctness of the procedure. With the use of lean materials such as the shadow board, deficiency associated with forgetfulness or lack of knowledge in the preparation of various types of anesthesia can be eliminated. Thank you for your attention.